Hello everyone. Today we will be talking about congenital abnormalities. This first slide shows a character a lot of you might be familiar with, but let's pretend you don't know this character. Some of the first things that are going to come to mind are this gentleman's physical features. The gentleman in question is Quasimodo, and he has a congenital kyphosis, which is also known as a hunchback. He also has a facial deformity due to the large protrusion over his eye. The thing is, congenital abnormalities are much more common than you think, with the US alone having a statistic of 1 in 33 babies being born with a congenital abnormality. So what are congenital abnormalities? Congenital abnormalities, also known as birth defects and congenital anomalies, arise during fetal development and are structural or functional abnormalities that can affect appearance, development, or function in a person. How much a congenital abnormality affects a person varies based on each individual's unique condition because some congenital abnormalities require little treatment while others can require significant treatment options. And currently, there are over 7,000 known congenital abnormalities, but some of the well-known common examples you might be familiar with are cleft lip, limb deficiencies, congenital heart conditions, Down syndrome, fetal alcohol syndrome, cerebral palsy, and sickle cell anemia. So why are congenital abnormalities important to look at? The significance of congenital abnormalities lies in their potential to cause significant health problems. According to the World Health Organization, an estimated 240,000 newborns die worldwide within 28 days of birth every year due to congenital disorders. Congenital disorders cause a further 170,000 deaths of children between the ages of 1 month and 5 years old. Congenital abnormalities also affect an individual's physical and emotional well-being and place an immense medical, social, and financial burdens on families. The causes of congenital abnormalities are not completely understood, but we have been able to identify some important contributing factors. Genetic factors are well known to be contributing factors of congenital abnormalities. One example of this are when there are mutations in genes that control fetal development, which ultimately results in an abnormal growth. Another genetic factor is when chromosome abnormalities occur. For example, when there are too many chromosomes, you can have a child with Down syndrome due to the trisomy of chromosome 21. When there are not enough chromosomes, you can have conditions such as that of Turner syndrome, which occurs due to a missing entire X-sex chromosome. Another example is when chromosomes get deleted, creating conditions for Prader-Willi syndrome due to the child missing genetic information on chromosome 15. Environmental factors, both internally and externally of the mother, have been known to be contributing factors of congenital abnormalities. Some examples of these are when mothers are exposed to toxins such as drugs and alcohol, and chemicals like lead, mercury, pesticides, and dioxins. Some internal conditions are when mothers have an infection. The rubella virus, for example, has been known to cause congenital heart defects. Some birth defects are inherited from parents who express the congenital abnormality. Some examples of inherited traits are cystic fibrosis and sickle cell anemia. Another contributing factor is maternal nutritional deficiencies. An important nutrient for mothers is folic acid, and when a mother does not get enough folic acid before and during pregnancy, it can cause neurotube defects. Not all congenital abnormalities can be prevented, but there are some things that can be done before and during pregnancy to increase your chances of having a healthy baby. Start prenatal care as soon as you think you might be pregnant and see your healthcare provider regularly during pregnancy. Try to get any medical conditions under control before and during pregnancy. During pregnancy, try to include 400 micrograms of folic acid every day, and don't drink alcohol, smoke, or use street drugs. Now that we have finished talking about prevention strategies, let's talk about pre-screening options. One pre-screening option is preconception screening, which can be useful to identify those who are at risk for specific disorders or pass a disorder onto their children. This screening includes obtaining family histories and carrier screening, which can be particularly valuable in countries where consanguineous marriage is common. Another screening option is periconception screening. Periconception screening is useful in identifying maternal characteristics that may increase risk and should be used to offer appropriate care for mothers. This screening includes identifying risk factors associated with young or advanced maternal age, or even behavioral risk factors such as the use of alcohol and tobacco. Another periconception screening option is utilizing ultrasounds. This can be used to screen for major structural abnormalities or even Down syndrome. Maternal blood can also be used to screen for placental markers to predict the risk of chromosomal abnormalities or neural tube defects.
Neonatal screening is an important step towards detection of congenital abnormalities that may not be immediately visible. Newborns may be screened for certain metabolic, hematologic, and endocrine disorders, which are all congenital abnormalities that are not evident at birth but can manifest symptoms at various times in one's life. Early screening can also help with congenital abnormalities that affect daily functions such as hearing. Screening for hearing loss at an early age can provide opportunities for early correction and allows the possibility for acquiring better language, speech, and communication skills. As we have mentioned before, congenital abnormalities are not completely preventable and have a wide range of symptoms, each with their own set of concerns. This being the case, it is important to treat each congenital abnormality with specifically treatment options that best address each condition. Some congenital disorders can be treated with medical and surgical intervention. Surgery with good follow-up care can often mitigate the potential lethality or the morbidity associated with structural congenital abnormalities. Other types of treatment for certain congenital abnormalities may require long-term support, which can include physical therapy, speech therapy, occupational therapy, and support from families and community. This can include the utilization of a wide range of devices such as hearing aids, glasses, prostheses, wheelchairs, and even more extensive devices such as ventricular assist device. Gene editing has been a big research topic among congenital abnormalities and could potentially lay the groundwork for more sophisticated medical intervention. One study done recently in Japan demonstrated specifically multiple chromosome cleavage to eliminate the trisomy 21 chromosome in Down syndrome. This works by regularly interspaced palindromic repeats of Cas9, which is a protein that acts as molecular scissors in the CRISPR Cas9 gene editing system to cut DNA at a specifically location, and this eliminates induced pluripotent stem cells and fibroblasts, thus ultimately eliminates the target chromosome from human trisomy 21. A more recent case involves researchers at the Children's Hospital of Philadelphia and Perelman School of Medicine at the University of Pennsylvania developed a customized therapy using CRISPR to treat an infant with an incurable disease. The patients were diagnosed with carbamide phosphate synthetase 1, a condition characterized by an inability to fully break down byproducts from protein metabolism in the liver, causing ammonia buildup to toxic levels, but through gene editing therapy, the infant has been able to overcome the morbidity that carbamide phosphate synthase 1 entails. In this case, the child in question was able to overcome sicknesses that normally could be extremely dangerous for children with this condition, especially with the possibility of ammonia reaching dangerous level in the brain. In conclusion, congenital abnormalities cause a wide variety of symptoms that affect a person's structures and even bodily function. Congenital abnormalities are important issues to address due to their potential harm to health. Even though they cannot be fully prevented, there are steps that can be taken to help increase the chances of having a healthy baby. Prescreening is key to help reduce the mortality and morbidity to ensure the proper treatment and care for populations of congenital abnormalities. So the question then becomes, what's now? Further research for congenital abnormalities must continue and gene editing could potentially lay the groundwork for more sophisticated medical intervention.